The Centers for Disease Control and Prevention has issued an urgent warning about a Listeria outbreak linked to deli meats. This outbreak has already claimed the lives of 2 people and hospitalized over 24 more. Sadly, the CDC believes the true number of cases is likely much higher. Many people experience mild symptoms and may not seek medical attention. This makes it harder to track the full extent of the outbreak. The CDC is actively investigating the outbreak, trying to determine the specific contaminated products and their source. Currently, no illnesses have been linked to prepackaged deli meats. The outbreak has been reported in 12 states so far, with New York and Maryland having the highest number of cases. The CDC urges consumers to be cautious when consuming deli meats, especially those who are most vulnerable to Listeria infections. This outbreak highlights the serious threat of foodborne illnesses and underscores the importance of proper food safety practices. The CDC is working diligently to control the outbreak and keep the public informed. The CDC is working tirelessly to identify the source of the Listeria contamination. Their investigation is focused on deli meats sold at counters in various supermarkets. While no specific products have been recalled yet, the CDC advises consumers to avoid eating deli meats altogether. If you must consume deli meats, be sure to heat them thoroughly to kill any potential bacteria. Investigators are meticulously collecting data and samples to pinpoint the origin of the outbreak. They are examining any commonalities among the affected individuals, tracing the supply chain back to the source of the contaminated meat, and looking for any potential points of cross-contamination. The CDC is collaborating closely with state and local health departments. This coordinated effort helps gather information and control the outbreak more effectively. The CDC will continue to provide updates as the investigation unfolds. Consumers are urged to stay informed and follow the CDC's recommendations for safe food handling. Listeria monocytogenes is a type of bacteria that can cause a serious infection called listeriosis. While anyone can get listeriosis, certain groups are at a higher risk of severe illness. Pregnant women are particularly vulnerable. Listeriosis during pregnancy can lead to miscarriage, stillbirth, premature delivery, or serious health problems for the newborn. Older adults, individuals with weakened immune systems, and young children are also at increased risk. Symptoms of listeriosis can vary. Some people experience mild flu-like symptoms like fever, muscle aches, and fatigue. Others develop more severe symptoms like headache, stiff neck, confusion, loss of balance, or convulsions. Listeria is a hardy bacteria that can survive and multiply even in cold temperatures, like those found in refrigerators. This makes it crucial to handle and store food properly to prevent contamination and the spread of this potentially deadly bacteria. Section 4. Protecting yourself and your family from Listeria. There are several steps you can take to reduce your risk of contracting Listeria. These precautions are especially important for those in high-risk groups. Cooking meat thoroughly, especially deli meats, is crucial. Heating food to a high enough internal temperature kills harmful bacteria like Listeria. Hand washing is another essential practice. Wash your hands thoroughly with soap and water after handling raw meat, poultry, and seafood. Also, wash your hands after using the bathroom, changing diapers, and touching animals. Avoid cross-contamination in your kitchen. Use separate cutting boards and utensils for raw meat and ready-to-eat foods. Keep your refrigerator clean and ensure it maintains a temperature of 40 degrees Fahrenheit, or 4 degrees Celsius or below. This inhibits the growth of bacteria like Listeria. Be aware of food recalls and dispose of any affected products immediately. Section 5. Past outbreaks. A reminder of Listeria's persistence. This recent outbreak is not an isolated incident. There have been other Listeria outbreaks linked to various foods. In June of this year, a Maryland-based food manufacturer recalled several ice cream products due to potential Listeria contamination. This highlights the persistent threat of Listeria and the constant need for vigilance in food safety practices. These outbreaks serve as stark reminders that foodborne illnesses are a serious public health concern. It requires a concerted effort from government agencies, food manufacturers, and consumers to minimize risks and protect public health. The CDC and other health agencies continue to emphasize the importance of consumer awareness and proactive measures to prevent Listeria contamination. By understanding the risks and taking appropriate precautions, we can all contribute to a safer food supply. Section 6. Food safety matters, staying informed and vigilant. Food safety is everyone's responsibility. Staying informed about potential outbreaks and following safe food handling guidelines is crucial. The CDC's website is an excellent resource for up-to-date information on foodborne illness outbreaks, food recalls, and safe food handling practices. Report any suspected cases of foodborne illness to your local health department. Your report can help health officials identify and investigate outbreaks, ultimately protecting others from getting sick. By working together, we can minimize the risk of listeria and other foodborne illnesses. Remember, food safety starts with you.